Hi everyone, thanks for joining and the nice introduction. First I wanted to gauge where everyone is at in the webinar. So I have a quick poll. So has anyone used a cause and effect or fishbone diagram previously? So no, never, seen but never completed myself, done but not comfortable with the tool, or very comfortable. So you could all just take a second to check that in. All right, I'll give you a few more seconds. Okay. So it looks like some are very comfortable. It looks like the majority have done but are not comfortable with the tool. And then also seen but never completed myself. So for those who are very comfortable, this might be kind of repetitive, but hopefully we can provide more insight. But done and not comfortable, hopefully we can make it even more so. And then if never, welcome. Get excited to start learning how to use a cause and effect diagram. So we'll go to, today I'll go through briefly the webinar agenda, what we'll be discussing today. So we'll discuss what a cause and effect diagram is, when and why to use this, and what the components of it are, and how to apply it in a healthcare setting. So what is a cause and effect diagram? Well, it's a tool that helps identify, sort, and display possible causes of a specific problem. It's a useful visual that demonstrates all the factors a team or a group brainstorm that influences the outcomes they're looking into. So a cause and effect diagram does have many names. It often varies depending on the organization or person that you're working with and what they feel most comfortable calling it. Some call it an Ishikawa diagram after the Japanese inventor, but it's also known as a fishbone because, as you'll learn, it resembles a fish's skeleton. So what is a cause? The definition is parts of a system and forces outside a system that directly influence the outcome or aim of your problem. So an easy example I think many of us can relate to as a cause of low hand hygiene compliance rate is provider behavior. So getting providers to change their behavior and wash their hands directly influences the compliance level within the unit or hospital. But overall, there's lots of causes that contribute to a certain effect. So for example, we'll use the poor hand hygiene. Clinicians will say they're too busy. Sometimes they wash their hands, but they don't do the proper techniques. The sanitizer dispenser might be broken. Maybe the sanitizer dispenser is not located directly next to the room, and it's located across the hall. So there are many causes as to why there might be that poor hand hygiene, or maybe it was just empty. So when you're doing a cause and effect diagram, all causes should be brought up. Most likely you aren't the only one who actually thinks a specific cause influences the problem you're focusing on. So honestly, the more causes, the better. It allows you to fully understand the process and the issue that you're looking into. So when should a team use this tool? Well, one, to identify possible root causes. So ask the 5 whys. If you never heard of this, the 5 whys is literally when you ask why 5 times. So I'll continue to use the hand sanitizer example. 1, why did the physician not use the sanitizer? Well, it was empty. 2, why was it empty? Well, it was empty because cleaning staff only checks it in the morning. So now 3, why do they only check it in the morning? Because only day shift cleaners have access to the equipment room. Then you would continue to ask why 2 more times. And as you continue to answer the questions, you'd fill out each area of concern on the cause and effect diagram, as I'll show you later. Second, another reason when to use this would be to sort out and relate some of the interactions among the factors affecting a particular process or effect. Also to analyze existing problems so that corrective action can be taken. This helps reduce others from jumping to conclusions. For instance, a lot of the time people will say there's not enough staff to change the sanitizer pumps, so we need to hire another full-time housekeeping employee. Well, after answering the 5 whys that we discussed earlier, that might not be the case. It might just be the employees all need proper training or that there's access to complete this task. And this is why the cause and effect diagram is really useful, because it helps you figure out what the root and what the actual problem is, or the processes that are causing the problem. So why should a team use this tool? Well, like I said on the previous slide, 1, to help determine root causes. 2, it encourages group participation. It really brings teams together. It creates this buy-in from staff, from different areas. It makes them want to be a part of the change. If they feel that their voices have been heard, they're more likely to participate and continue to implement what you find. 3, it uses an orderly, easy-to-read format. It's visually appealing. It indicates possible causes of variation. Next, it increases process knowledge. So maybe the process is actually more complicated than originally thought, and this tool allows you to break it down to understand each component and what is occurring at each point. For instance, when I looked at a nurse call bell system problem, I thought it was relatively simple that a patient, when they would hit it at the side, at the bedside, I thought it was relatively simple, the computer and technology basis, but then I found out no one actually knew the computer process and what actually happened and who even owned it. So it increases an overall process knowledge. Identifies areas for collecting data. I feel like sometimes people get bogged down with the term measurement, but this tool kind of helps alleviate that stress. It helps you figure out where you should specifically look at to implement the changes and measures, and doesn't allow you to randomly guess because you've already done your brainstorming. So again, some major overall advantages are, if you couldn't tell from the past 2 slides, this is a great tool to use. So I'll go through them really quick. It operates through the function of joint brainstorming discussions. Again, people like to feel that they're involved and included. Brainstorming allows for broad-ranging thinking, steering teams away from interrupt thinking patterns. It gets you out of that, oh, we need another person to fulfill this. Really, we can probably utilize the people we have better. These diagrams ask, why does this happen again and again, just like the 5 whys I described. And it allows for prioritizing relevant causes, so the predominating underlying root cause is addressed first. So you can figure out which cause you really need to hone in on versus some that are just surface level. So now I want to show you what a basic layout of a cause and effect diagram is. As you can see here, this is the basic shell for the cause and effect diagram. When developing a cause and effect diagram, you're constructing a structured pictorial display of a list of causes. There are 5 listed here, cause A through cause E. Some have only 4 and others have 6, but it is organized to show the relationship to the specific effect. So as you can see, they're all going into all the potential causes or going into the effect that you're specifically looking at. So as you can see at the bottom, it says what factors make the difference. In the next slides, I'll outline the steps for constructing and analyzing a cause and effect diagram. So let's get started with step 1. So identify and clearly define the outcome or effect that you're analyzing. So decide on the outcome to be examined. These can be stated as particular quality characteristics, problems resulting from work, planning objectives, etc. Use operational definitions. Develop an operational definition of the effect to ensure that it is clearly understood. I'll explain on the next slide further in detail what an operational definition is, so that way everyone's on the same page. And remember, an outcome, or everyone's on the same page when you're doing this with your team or your group or your unit. So then remember, an outcome or effect may be positive, which is an objective, or negative, a problem. So depending on the issue that's being discussed. When using a positive effect, which focuses on a desired outcome, it tends to foster pride and ownership over productive areas. This may lead often to like an upbeat atmosphere that encourages the participation of the whole group. It gets everyone involved. They don't feel that, there's any blame. So when possible, it's preferable to phrase the effect in positive terms. However, on the other side of things, using a negative effect can sidetrack the team into justifying why the problem occurred and place blame. However, it is often easier for a team to focus on what causes an actual problem and what causes an excellent outcome. So they might feel even more. So a positive to the negative or a problem would be that they might feel more advantageous to fix it. So while you should be cautious from the fallout that can result from focusing on a negative effect, getting a team to concentrate on things that can go wrong or have gone wrong may enhance the actual group participation. Next up, we'll further expand what I meant by the operational definition, and that I'll just read the definition. It's a precise, user-friendly description of what is to be measured and observed so that any person taking or interpreting the data will get the same results. And to get the same results is really what matters, is that anyone can duplicate what you're looking for. And then also everyone, when they're sitting at the table or listening or participating in this, knows what you mean when you say, for instance, a fall. So maybe a unit secretary doesn't have the clinical knowledge or understanding what you're specifically looking at when you say fall. And this way you have a specific definition that says unplanned descent to the floor. Or if it's more complicated and it's an appointment creation time and maybe the person on the floor hasn't used Epic before or understands what you mean by appointment creation time when you're describing something, you can clearly define it as the time at which the urgent add-on appointment was created in Epic's scheduling system. So it clarifies that this is an urgent appointment, not just any appointment whimsically. So overall, it will help you and your team to measure and to figure out what causes go into the effect. So help everyone to also understand what the start and end points are for your project or goal. It defines it clearly that maybe the start is, for instance, a nurse call system. The start is when the patient presses the button, and the end is when the nurse closes the loop of communication. So the example on the next few slides that I'm going to actually use is based off of a practice cause and effect diagram from the Institute for Healthcare Improvement, or IHI, which I've broken down into steps and will expand upon. So step 2 is first you're going to draw this horizontal line that's called a spine. To the right, you'll see let me get an arrow. To the right, you'll write a brief description of the effect or outcome which result from the process. So right here, you would write that effect. If performing a QI project, like a quality improvement project, this outcome typically comes from your aim statement. The example we are going to use is something I'm sure we all can relate to, which is our car will not start, especially sometimes in these negative degree temperatures in Massachusetts. So then you'll draw a box or a circle around the description of the effect. It doesn't need to be super pretty. You can even just write it if you're doing this on paper. So you'll draw that box. There are many templates also online that will already have this pre-made for you. It's just important to understand the foundation. If after this webinar you actually like the template that I'll show you throughout my slides, I'd be happy to share it with you and provide my email information at the end of the session. So we'll go into step 3. Let me click this. So identify the main causes contributing to the effect being studied. So now that we identified the effect, which is the car will not start, we need to determine the labels for our major branches. As you can see, we have 5 listed here, which is environment, methods and procedures, machines, equipment, and then materials and people. These labels become categories under which to list the many causes related to those categories. Write the main categories you've selected to the left of the effect box. As you can see, they're all on the left. And some above the spine, like environment, methods, procedures, machines and equipment, and then also some below, like materials and people. You don't want to get it too crowded. This, as you can see from the skeleton, this is why many call it a fishbone diagram, because it looks like the skeleton of a fish. Typically, these are the 5 categories used. However, you can make it specific to your project or focus, and I'll demonstrate an example in a few slides. But first, I want to further define each category. So each category, materials means supply, design, availability, and maintenance. Methods, procedures. You can put just methods or just procedures, but often people do the hyphen. So it's steps in the care process and steps in the supply chain. Environment can include staffing levels, their skills, workload and shift patterns, any administrative and managerial support, the actual and physical environment, the physical plant, any policies and any regulations that impose that environment. The machine and equipment is any equipment or tools needed to get the job done. So for instance, a pager or a phone. People, staff knowledge, skills training, competence, patient behavior, and supervision. However, even though these are like the main ones we use, often in healthcare, other industries do use different categories. So you'll see, if you ever Google a cause and effect diagram or fishbone diagram, you'll see that manufacturing follows the 5 M's, which means man, machines, materials, methods, and measurement. And non-manufacturing systems sometimes use the 5 P's, which means patrons, people, provisions, places, and procedures. Just make sure that the categories fit your project. However, in healthcare, again, these are what's typically seen. But I wanted to show you that one with categories that were designed for a specific focus. As you can see, this one is for the specific effect of an emergency department throughput time. And if you look at the potential causes, they've used 6. So like I said, you can use from 4 to 5 to 6 different major cause branches. And you'll see that this one has patient assessment, treatment, registration, discharge admit, consultation, and patient arrival. I typically always go with the 5 that I previously showed you, but for this group it looks like it was just more beneficial because it just broke it down specifically into what they needed. So it's just a quick example of how you can develop your own. So step 4. Identify your causes. So again, the effect was the car will not start, and using the 5 causes, environment, methods, procedures, etc., we want to identify other specific factors, which may be the small or minor, which may be the other causes. Excuse me. So you want to identify as many causes or factors as possible and fill in detail for each cause. If a minor cause applies to more than one major cause, listed under both. So if you have confusion whether it might be under people and environment, you can do it under both if it actually is justified to do so, if you feel it's justified to do so. So as you can see for environment, we listed 2 cold. So in January, it's pretty cold out there. Especially last week. Methods and procedures, maybe you're not pressing the accelerator, you're locked out of your car. So that's why it won't start. You can't even get in it. Machines and equipment, maybe your starter's broken, your battery's dead, your engine overheated, or your battery cable's corroded. Other materials would be, keys are very important. So if you lost your keys, you're not going to be able to start your car. You're out of gas. Especially in cold weather, you need to keep your tank filled. Or people, maybe you just don't have the proper training. Maybe you don't have a license and you're just driving your car. Or you're using the wrong key. You grabbed your spouse or your boyfriend or your roommate's key and you realize, oh, this isn't mine, so it's not going to start your car. or you just don't do preventative maintenance. So now that we've identified some causes to our effect, which is our car will not start, we want to start thinking of more details when identifying these causes, and this leads to branching. So you'll see branching and analyzing. Branching occurs when there are many details as to why the cause occurred. So for example, why was maintenance poor? Well, maybe it was poor because I'm poor, or I have a lack of money. Or maybe it's because I had no awareness. I assumed my oil only needed to be changed twice a year. However, it should be done actually every 2 months. So I'm going to go back to the previous slide. So you would find maybe no preventative maintenance, and that's where you would, I'm trying to draw on something, you would draw like a branch off of that, and you would write, oil, I don't know, I'm not going to write it out, it looks too sloppy, but it would be kind of similar as like, that's where you would write, didn't know oil should be changed every 2 months, or something to that effect. So that's where you would branch off that specific one. So I'm going to go back to the slide. So also it helps to analyze and identify the causes that warrant further investigation when you start to look at the full cause and effect diagram. So you're going to look at the balance of your diagram. You're going to check for comparable levels of detail of most of the categories. So a thick cluster of items in one area, so if specifically it's a people problem, it may indicate a need for further study, or a main category only having a few specific causes, such as environment, may need a further identification of causes, so maybe take a deeper look as to why you can only find one. Also, look for causes that appear repeatedly. If there are those causes in different areas, they may actually represent a root cause. Additionally, look for what you can measure in each cause so you can quantify the effects of any changes you make. For example, maybe I lose my keys all the time, so I can measure how often I lose my keys. So if over the week I lost my keys 10 times, maybe 10 times, it might be because they're always in random locations. So maybe I can place a basket next to my door to help reduce keys being lost, and then I can remeasure how often I lost my keys the next week. But most importantly, identify the causes you can actually take on. So for example, in the environment category, you'll see too cold. I can't take on the weather being cold in Massachusetts in January. That's not something I can change. So I guess just understand your scope. I mean, I guess I could change and move to Florida, but I can't at the moment. So that's something I can't change. So make sure you focus in on the ones that you can actually measure and look at. So this is this slide really I wanted to use to illustrate what branching and analyzing means. This is actually one that I created and used in a previous position for my quality improvement project when I was doing Lean Six Sigma. And the effect was inadequate communication via the nurse call system. So as you can see, I used my favorite 5 major causes: environment, method, procedures, machines, materials, and people. And if you look under people, it says you can clearly see that the major areas of concern are people and machines and equipment. That's where most of my branching and most of my heavy outlet causes are. So for instance, people. We looked, there's a perfect branch over here. Let me highlight it so you know where I'm looking. So no one to answer the console. So that was, for this specific project, that was a clear, everyone kept bringing this up. Well, when the patient presses the call button at the bedside, it would go to a phone at the unit coordinator or secretary's desk, who would then do the paging. Well, if no one's able to answer the console, well then there's no communication about who's getting that call for 5 minutes. So why was there no one to answer the console? Well, we decided that no one was at the console because, well, no lunch coverage. So for an hour, there would be no one, or random people answering. So maybe they didn't know how to do it. or they stepped away for a task. So when they went to go to the bathroom, maybe there was nobody there for that time when someone called. So that's something you can look at. Another one is the RN or clinical assistant or medical assistant, as some places call them, is unavailable to answer the phone when they're actually paged. So maybe someone is at the console and does page them, but maybe it's an emergency. That RN that was being paged is in another room, or precautions. So maybe they're in a room with another patient and they're gowned and they're unable to pick up their phone, or they're on a phone with another patient. So those are all legitimate causes as to why they're unavailable to answer that phone. And so this is where you can think about, why is this occurring? How can we look at these causes and reduce this and measure if this is actually happening? So I wanted to show you a real-world clinical setting one that made a big difference at Boston Children's. So I guess how to incorporate this into your healthcare setting. So enable, I discussed this before, involving everyone into the brainstorming exercise and involving all the participants to be included. So enable all the stakeholders and participants and staff to be present in the brainstorming exercise, or at least someone who represents them. It's really important to ensure the meeting covers all aspects of the problem. Make sure the group understands the problem to be discussed clearly. Like I said, really utilize operational definitions. I think people too often skip over that piece and just assume everyone knows what you mean. Often people where I work now will say wayfinding, and I never really used that term before here. So when they would say that, I was just like, where are they wayfinding to? So break that down into specifically what you mean, and that will help you develop the appropriate causes for your effect. Use paper, so the file diagram can be typed up. The one I just showed you, this diagram, did not look this pretty. I spent many times editing and fixing this and getting various people's opinions before I did it. Best to use large Post-it notes, sticky pads. Also, you can use like a whiteboard and draw the outline. That's why I wanted to give you that base outline so you could draw it. And then I find it's best when you just give everyone a Post-it note square. So just give everyone their own square so they can write their ideas down without judgment, and you can place it, and they can place it in the appropriate categories. So if a secretary is on there and maybe there's some physicians or nurses or their boss, some managers, and they don't necessarily feel comfortable stating the cause that they believe occurs all the time, this kind of removes that. They're able to just write on the sticky, put it up themselves, and it allows everyone's opinion and voice to be heard. So where can this be completed? Obviously in scheduled meetings. You can obviously schedule. It's hard, though, sometimes to get everyone who you need in a meeting. So when I did my nurse call system one, I did it a lot. I performed on different floors in nurses' stations. So I had in the main meeting, we all brainstormed. I had all the stakeholders there, and we all brainstormed, but then we hung up I took a photo, and then I redid it on their whiteboard in the nurses' station. And the nurses on that unit that we were thinking about piloting would just post their own Post-it notes in areas, or they would like check mark on a Post-it note already there, stating that they agreed with this, they thought it was correct. Also in break rooms, this is also where you can get the administrative assistants or managers or other people involved. So again, they can feel when you're actually implementing a measure or a process improvement, they can feel that they were involved in the actual process and they were heard. I think I can't stress enough that when you're doing a quality improvement initiative, or when you're trying to figure out the root cause or to identify these causes to the effect, it's really important to make sure everyone's involved if you can, or at least people of those areas are involved. So overall, now that we have dived into what a cause and effect diagram is, such as when to use it, what it looks like, etc., I want to review why it's valuable to your team. So one, it helps teams understand that there are many causes that contribute to an effect. So it's not just one thing. It's not just because we don't have enough staff. It's not because physicians don't just feel like pumping in and pumping out. You know, there's probably other areas there's probably other causes that contribute to that. Two, it graphically displays the relationship of the causes to the effect and to each other. So it's an easy visual. When you look at this, it may seem like daunting at first, I guess, if you look at the nurse call system one, but then if you break it down, it's a nice visual display of what is going into that effect that you're looking at. And three, it helps identify areas of improvement within your project or your focus for your unit or department, or even like your immediate, or even home, right? Regarding your car. So it helps figure out what you need to focus in on. So with that, hopefully I've been able to clearly describe what a cause and effect diagrams. Do you guys have any questions?
The conference has been unmuted.
Clara, thank you so much. That was excellent.